Hello everyone, this is Nilanjana coming back with the second video on periods and period related problems. The first video was quite a while back and I apologize for the gap between the two videos, but continuing on the same topic, I would like to start my second video. I've been a GP for the last 20 years and a doctor for the last 25 years. I've also qualified in women's health, in sexual health, and in contraception. Periods are something that we are supposed to just carry on a monthly basis. So it should not affect us and it should be just part of our monthly routine. But for so many of us, that is not true. So many of us look to the week of periods or the 5 days of periods with real dread, and because we experience a lot of pain, a lot of discomfort, and a lot of problems trying to get on with our daily lives. If the periods are very heavy, or if the periods are very light, or if the periods are very painful, then all of this poses a problem. If the periods are very heavy and this is not letting you do what you do on a daily basis, meaning your job and your activities of daily living, then this needs investigation in the form of blood tests and in the form of an ultrasound scan. So the blood test will look into the iron levels, making sure you're not losing too much blood and becoming iron deficient. It will look into your thyroid function and it will look into the hormone levels in the body. The ultrasound scan is designed to look inside the womb to make sure there is no fibroid which is making you bleed heavy, that the endometrial thickness, the lining of the womb, is also of normal thickness. It is not too thick or there aren't any lumps on the side of the womb that is making it bleed. Also, we need to look at the surrounding structures like the ovaries to make sure everything is just ship-shape. If the periods are too light and this is causing concern, then it is best to see your doctor or your health professional for the same range of tests, mainly blood tests and an ultrasound scan. And again, we will be looking for the hormone levels and we will be looking very closely at the ovaries on scan at this point, because we are worried that you might have polycystic ovaries which have given you the light spotting type periods. When you go for a scan, please make sure you drink a minimum of 2 liters of water, because when we drink lots of water, the bladder is full of water and this water is used as a portal for the scan. So the ultrasound waves, they travel through the water in the bladder to reach the uterus, and therefore we get a good picture of the uterus on scan. However, we also need an internal scan, also called a transvaginal scan, to make sure we look at the ovaries. So the scanner or the radiographer will ask for your permission to do an internal scan. Please give this permission, because otherwise we cannot see the ovaries and we cannot find out what is wrong. The probe that is needed to do an internal scan is really tiny and it can cause mild discomfort, definitely no pain when an internal scan is done. So please allow the internal scan so we can get a good view of the ovaries. Now coming to the pain side of things, we expect a little bit of pain when the period starts. So day 1 or maximum day 2, pain or discomfort. But if the pain carries on through the period, then you need to seek the help of a health professional or your doctor to look into this and to order testing. In this case, we are looking for signs of endometriosis, because that is what the painful period might be pointing at. There is also the scenario where periods start very early or they do not start. We have all been seeing periods starting earlier and earlier in young girls, and I have seen periods starting as early as 7 and 8 year old. If, for example, in this day and age, a period starts in somebody who's 5 or 6 years old, that is where we would refer the child to pediatric endocrine to look for the reasons for the early start of the periods. So this is something that needs to be referred to hospital straight away for scans and blood tests and further investigations. On the other side of the spectrum, we have patients coming in with their mums. So the patient is 15 or 16 and the mum is very concerned that the patient has not started her periods yet. This also is another similar scenario where the patient needs to be referred into hospital to find out why the puberty is delayed. Of course, if there are any other delays developmentally, this would all tie in. But if the puberty is the only thing, or the period is the only thing that is delayed, then this needs special investigation by the pediatric endocrine team. In conclusion, I would like to say that this is a very short whistle-stop tour through periods, and I would be happy to do another session or answer any queries or any concerns that might come up while you listen, or maybe some concerns that you've had for a long time. Please do not hesitate to post your comments, queries, and any other suggestions you might have in the box below. Thank you very much. Thank you for listening.